Hello, everyone. Our tech talk will be on telemedicine in clinical decision making. Telemedicine, according to the American Telemedicine Association, is the use of medical information exchanged from one site to another and includes a variety of applications and services using two-way video, email, smartphones, wireless tools, and other forms of telecommunications technology. In relation to clinical decision making, telemedicine involves the use of telecommunication to diagnose, review, or manage patients. Telehealth is defined as the use of electronic information and telecommunication technologies to support long-distance clinical health care, patient and professional health-related education, public health, and health administration. According to the American Hospital Association, there are three main modalities in respect to telehealth. There is real-time, a live, two-way interface between a patient and a healthcare provider which uses audiovisual technology. Store forward comprises of a transmission of patients' documented health history via a secure electronic communication systems to a provider and is generally a specialist. And third, we have remote patient monitoring, which encompasses the collection of a patient data via electronic communications. Examples of this modalities that we are using today is known as one is telestroke. Telestroke programs offer community hospitals an exciting opportunity to improve community access to acute stroke intervention and treatment. Telestroke is defined as the use of high-quality interactive telemedicine in acute stroke intervention. It's an example of real-time live interaction with patients. There is also telepsych, which is telepsychiatry is the application of telemedicine to the specialty field of psychiatry. The term typically describes the delivery of psychiatric assessment care through telecommunications technology, usually video conferencing. We also have EKGs, which is an example of remote patient monitoring, and also pre-recorded video examples, which are examples of store forward. So who are our stakeholders in telemedicine? They would be physicians, registered nurses, advanced practice nurses, as well as interns and residents in various teaching organizations. So how is telemedicine used today? Telemedicine is used today actually to treat acute and critically ill patients. Telemedicine is also being used in our EICUs, and in EICUs, it allows a critical care team consisting of ICU physician, critical care nurses, and support staff to monitor and treat intensive care patients from a remote location. Telemedicine is also being used in rural trauma care, remote rural isolated communities, as well as community hospitals. The value of telemedicine is that it allows a consultant to interact and consult with rural providers via interactive technology. The consultant may be a board-certified surgeon, fellow, or resident that interact with all stages of patient care. It also enables primary care providers to receive immediate life-saving advice or instruction from the consultant. It also allows injured patients to be identified quickly and rapidly transferred to trauma centers. The advantages of telemedicine? Well, they have found that it lowers medical and pharmacy costs, it lowers the rates of hospital admissions and readmissions, and it also reduced the costs associated with hospitalization of nursing home residents. Just as with any new treatment and involving patients, we must have effective communication. Effective communication is essential for quality patient care. It decreases clinical errors as well as improve our patient outcomes. And as most healthcare professionals are familiar with, is known as SBAR. SBAR is actually a communication tool that is used between physicians and nurses, and it also consists of situation, background, assessment, and recommendation. There is also Crawford, who also has a recommendation to enhance registered nurse and physicians communication. Crawford recommends that we respectfully greet each other and introduce new staff members to other care providers, that we establish a non-hierarchical and collaborative communication structure, that we use a structured tool such as SBAR to focus on patient care needs, and encourage active participation such as multidisciplinary rounds. As far as cost effectiveness, a telemedicine system requires hardware, software, and other communication commodities. Cost effectiveness is based on the concept of incremental costs and or incremental outcomes. When we talk about incremental costs, it refers to the cost difference of telemedicine being implemented versus alternatives of not being implemented. When discussing incremental outcome, this refers to improvement or lack of improvement once telemedicine has been put into place. This image here shows the advantages as well as cost effectiveness and the demands for telehealth by patients. As you can see here, 74% of teleconsults led to a change in diagnosis or treatment. 60% of telehealth cases solved without a face-to-face visit. And on the economic end, a telehealth consult could be about $30 compared to $75 for an office consult. The telehealth market is presumed to hit about $6.28 billion by 2020. So as you see, this is a great advantage for our patients. Funding. Well, grants are available through the Department of Health and Human Services to provide technical assistance in the development of telehealth services in rural communities. But with these grants, they require quantitative outcome studies to measure the impact on quality of care, the appropriateness use of technology, and whether care access and clinical outcomes were improved. Also, as just with any new practice, there's always going to be barriers. The barriers that are found with telemedicine are 1, funding, technical problems, the interruption of care. And when we talk about the interruption of care, these are actually perceptions that can be perceived by nurses or patients or staff that telemedicine is just an interference. Also, educational support for nurses moving into telemedicine. The future of telemedicine. As we know, the future of telemedicine, we now have standard of care in most organizations, which now includes telemedicine and telehealth to improve access, quality, and patient outcomes. Nurses and advanced nurse practitioners should be knowledgeable concerning their scope of practice, whether it's legal, regulatory, and ethical guidelines when using telemedicine. Telemedicine is also being used to improve health outcomes in urban and rural communities due to the lack of access and participation. In regards to chronic diseases such as congestive heart failure, stroke, and COPD, telemedicine has proven to increase the quality of long-term monitoring and decrease or prevent complications. We also have an app known as the Doctor on Demand app. The Doctor on Demand app is from a company based in San Francisco and backed by Google. Over 1,500 participating physicians and more than 1 million downloads. It offers app-based video visits with board-certified physicians for only about $40. There are also psychologists as well as lactation consultants on demand. They have found that in this app, they are treating commonly treated ailments such as cold and flu, sore throats, urinary tract infections, travel-related questions, as well as sport injuries. Statistics show that 95% who use the app are treated and the remaining 5% are referred to specialists. In conclusion, statistics show that by 2020, the number of Americans older than 65 will increase by 36%, while the physician supply will hardly keep up, particularly in primary care. Statistics also report that Americans at this age are retiring outside of the U.S. or in rural areas. The physician and patient may be in different states. Now, doctor offices are communicating with physicians and their patients via text, video, or picture messaging. Although we know telemedicine cannot replace the sensitivity or specificity of a doctor or nurse's touch, evidence shows that the technology is a viable solution in reaching and treating patients. It will be exciting to see how telemedicine continues to change our practices. And thank you for your time.